$1 trillion. That is now the estimated cost of the opioid crisis, according to a new report. Meg Tirrell joining us now with more on a story that unfortunately just keeps on growing.
Yeah, it really does. And the $1 trillion estimate is total costs from 2001 to 2017 from the opioid crisis in the United States. That's according to an analysis released today from nonprofit health research group Tirrell. And those costs could accelerate in the next few years, the report warns, if the epidemic persists at its current rate, adding an additional $500 billion in costs by 2020. Of course, the opioid epidemic has ravaged the United States, with 2017 opioid overdose deaths estimated to have exceeded 62,500, according to Tirrell today. Lost productivity and wages from overdose deaths are the biggest contributor to costs in today's analysis, with costs of health care, criminal justice, and family assistance also contributing. And though, of course, the $1 trillion from 2001 to 2017 is a staggering number, you guys might remember that recent report from the White House's Council of Economic Advisors, which estimated the cost of the opioid epidemic at even higher levels, $504 billion in 2015 alone. The vast majority of that, as you see, coming from fatality costs, guys. So the costs obviously are staggering. The numbers are staggering. And people say we need to be doing more about this.
Yeah, I'm actually surprised that $1 trillion over, what was it, 17 years
Right.
is all it is. And it also depends on how you calculate and where you calculate. People who are addicted, have the disease, and are not participating in the economy as a result of that.
Yeah,
and there are a lot of them.
These higher estimates that we've started to see have been from estimating what the lost wages and the lost productivity are from the deaths from opioid overdose. But of course, folks who are living with addiction, there is costs to that as well. So this all really adds up.
A few months ago, where my parents live in rural Virginia, a guy died at a stoplight in his car. People started honking, 2 o'clock in the afternoon, not moving.
Overdose?
They get out, check on him. He had an overdose at a red light in the middle of the afternoon. You look at the cost of this economically, so societally. You look at the cost of the diabetes and obesity epidemic as well. It really bothers me in a lot of ways. I'm sorry. We're literally, in many ways, the economic cost, the societal cost is so massive, it's almost incomprehensible.
Yeah. It really is. And you talking about the opioid overdose in the car that you talked about, when we were doing our series earlier this year, we were talking about naloxone. That's the opioid overdose reversal drug. And we heard stories from people who actually saved lives of people who had overdosed in cars, actually administering naloxone there and being able to reverse their overdose. So one of the things is more availability of that drug.
Hey there, thanks for checking out CNBC on YouTube. Be sure to subscribe to stay up to date on all of the day's biggest stories. You can also click on any of the videos around me to watch the latest from CNBC. Thanks for watching.